Guide. Understanding Obsessive Compulsive Disorder, OCD, and Coping with Obsessions. Introduction. Obsessive Compulsive Disorder, OCD, is a mental health condition characterized by persistent, intrusive thoughts, obsessions, and repetitive behaviors or rituals, compulsions, performed in an attempt to alleviate distress or prevent perceived harm. Coping with obsessions involves understanding the nature of OCD, developing coping strategies, and seeking professional support when needed. In this guide, we'll explore what OCD is, discuss common symptoms, and provide strategies for coping with obsessions effectively. Understanding Obsessive Compulsive Disorder, OCD. OCD is a chronic mental health condition that affects millions of people worldwide. It involves a cycle of obsessions, unwanted, distressing thoughts, images, or urges, and compulsions, repetitive behaviors or mental acts performed in response to the obsessions. While the exact cause of OCD is not fully understood, it is believed to involve a combination of genetic, biological, and environmental factors. Common symptoms of OCD. While symptoms of OCD can vary widely from person to person, some common obsessions and compulsions include: obsessions. Fear of contamination or germs. Intrusive thoughts about harm, violence, or taboo subjects. Symmetry or orderliness concerns. Fear of making mistakes or forgetting things. Unwanted sexual or religious thoughts. Excessive concern with cleanliness, hygiene, or safety. Compulsions. Excessive hand-washing or cleaning rituals. Checking and rechecking behaviors, e.g., checking locks, appliances, or body parts. Counting, repeating words or phrases, or performing mental rituals. Ordering or arranging objects in a specific way. Hoarding or collecting unnecessary items. Seeking reassurance from others or avoiding triggers of obsessions. Strategies for coping with obsessions. Practice mindfulness. Learn and practice mindfulness techniques such as deep breathing, meditation, or progressive muscle relaxation to increase awareness of your thoughts and feelings without judgment. Challenge obsessive thoughts. Challenge and reframe irrational or distorted thoughts associated with obsessions. Replace catastrophic or unrealistic thoughts with more balanced and rational ones. Delay rituals. Delay engaging in compulsive behaviors or rituals when obsessions arise. Start with short delays and gradually increase the time between the obsession and the compulsive response. Expose yourself to triggers. Gradually expose yourself to triggers of obsessions in a controlled manner, without engaging in compulsions. Over time, exposure can help reduce the intensity of obsessions and decrease the need for compulsive behaviors. Create a fear hierarchy. Create a hierarchy of feared situations or triggers, starting with the least distressing and gradually progressing to the most challenging. Use exposure therapy to confront and overcome each fear systematically. Practice acceptance. Practice acceptance of uncertainty and discomfort associated with obsessions. Instead of trying to control or eliminate obsessions, learn to tolerate them without resorting to compulsive behaviors. Seek professional support. Seek professional help from a therapist or counselor who specializes in treating OCD. Cognitive behavioral therapy, CBT, particularly exposure and response prevention, ERP, is the most effective treatment for OCD. Medication may also be prescribed in conjunction with therapy. Join support groups. Consider joining a support group or online community for individuals with OCD. Connecting with others who understand what you're going through can provide validation, encouragement, and coping strategies. Conclusion. Coping with obsessions associated with OCD requires patience, perseverance, and a willingness to seek help when needed. By understanding the nature of OCD, challenging obsessive thoughts, delaying compulsive behaviors, exposing yourself to triggers, creating a fear hierarchy, practicing acceptance, seeking professional support, and joining support groups, you can develop effective coping strategies and manage your symptoms more effectively. Remember that recovery from OCD is possible with the right treatment and support. Don't hesitate to reach out for help and take the first steps toward healing and recovery.